Hey, what's up, everybody? You're listening to Nursing Uncharted, the podcast that discovers uncharted conversations and uncharted specialties within your profession. Thank you so much for listening today. Be sure to subscribe to our YouTube channel at Nursing Uncharted if you haven't already, or if you listen on Apple Podcasts, please leave us a review because we love to hear feedback there. Let us know your thoughts, what you think about the podcast. We're also on Instagram at AMN Nurse, so make sure to follow that account for snippets of the episodes and everything travel nursing with AMN. This episode is sponsored by AMN Passport. AMN Passport is a highly rated app that AMN has created for travel nurses or prospective travelers. You can find assignments, book assignments, and manage everything all from your phone, which puts you on the fast track to your next travel job. You receive instant job match notifications when you download AMN Passport. So if you are interested in travel assignments, be sure to check that out. So today we are continuing a series that is based on the future of nursing, what we hope to see the future of nursing to be, what we hope it to look like, and where it's going. And we have a professor today, a nursing department chairperson, who implemented really progressive strategies within her nursing program to improve their NCLEX pass rates. Her students come from some of the most underprivileged counties in the U.S., and all strikes are against them, it seems, in some circumstances, to complete a rigorous curriculum like a nursing school can be. But she revamped her nursing program, and her students were able to not only graduate, but improve the NCLEX scores. The NCLEX scores that they saw jumped from like 70%, 74% to 100%. So I wanted to have her come on today to give us some insights on what those measures looked like. They're pretty amazing, and they are unconventional, some of them. So here to share her story is Dr. Mary Hanks. Dr. Mary Hanks is chairperson and an associate professor of nursing at the University of West Alabama. She received her Bachelor of Science in Nursing from the University of Alabama in 1993. Dr. Hanks holds a Master of Science in Nursing degree and a Doctor of Education degree from the University of Alabama. Her most noted accomplishment in nursing education to date is the creation of the accredited RN-to-BSN online program at the University of West Alabama. And I would also say what we're talking about today, revamping this ADN program at the University of West Alabama, is very notable. So, Dr. Hanks, welcome to the show.
Thank you so much for having me today. I appreciate it.
Yeah, I'm really happy to have you on. I think a lot of people can learn from your experience and what you were able to accomplish. I think your program is proof that being courageous enough to break molds in order to meet the needs of your students is doable. It's worth it, and it can radically change the programs.
Well, thank you for saying that. I don't know at the time that we thought that we were being courageous. We thought that we were just doing, what was necessary at the time for our program. When I took over as chair in 2017, I had been here since 2011 at the University of West Alabama as a faculty. Yeah. I had been bitten by the bug, and I wanted to come and I wanted to teach. And I got the opportunity to come here and teach students. And, we were just noticing that our NCLEX pass rates were not doing what we wanted them to do. Yeah. And also that our students, were kind of struggling a little bit on their test. And we just got a little nosy, and we wondered why. And for me personally, coming from the bedside, this is always interesting to me. Coming from the bedside as nurses, we are placed in classrooms as nurse educators with no formal education in actually teaching.
Yeah, right.
So that is always fascinating to me. And of course, we get in the classroom and we think that I know how to teach. I know this. I've been doing this all my life. I can teach this. And, and the first test come back from your students, and 20 of the students failed the test. But why didn't you know this? I taught this information to you. Why didn't you get it? Yeah. And so for me personally, I decided, I need some skills in actually teaching. And I decided to return to school to get my doctorate. And I wanted to get my doctorate in nursing education specifically to learn some tools about how to teach.
I think test taking, like nobody knows how to write tests also. That's not taught as a nurse.
That's exactly right. And that is interesting that you brought that up, because that is one of the skills that you learn in a nurse educator program, is how to write not just tests, but how to write test questions that are specific to the NCLEX licensure exam that students have to take, and that we were actually struggling with. And, I was fortunate enough to have a mentor who had been here in part of the faculty for over 20 years. And she sat down with me one-on-one while I was going through my nursing education program, teaching me how to write these questions.
Yeah.
In learning how to write the questions, though, I also was bold enough to buy a lot of books where I started actually taking questions from the student's perspective. Can I answer? I'm a nurse. Can I answer these questions?
Yeah.
Fascinating point. I did not get them all right.
I think that's a testament to how crazy those questions are sometimes.
That's exactly right. So, the priority that they were telling me that I should do as a nurse, well, I was not choosing those things as the first thing that I would do as a practicing nurse, which I thought was fascinating. So for me, it was like, okay, so how do we train students to think like a nurse? How do we train students to think, and how do we get them to think like us? Well, the first thing we have to do is start to think out loud. In the classroom, a lot of times we teach facts, but we do not attach the facts, if you will, to the way that we think about working through.
Sure.
Case studies, that's one of the tools that we use. How about we create a situation with the factual information, and we bring that, we give the students homework to do where they actually learn the factual information. Then we create a scenario for the students in the classroom and say, well, you know what? You're the nurse. We have this patient. And what if this happens? What will you do?
Yeah.
Depending on the student's answer, we change the patient according to the student's answer in the classroom. Before they get to the test, I had to learn in my nurse educator program that before we actually get to the test, I should know if the students know the information before we get to the test, not when we get to the test.
Yeah.
And in the classroom was the perfect way for us to figure out how to make that happen. So that was, those strategies of flipping the classroom is what we called that back then.
Yeah.
Flipping the classroom so the students actually knew the information when they came into the classroom. Learning to get rid of lecture. The lecture that all those PowerPoints that we would bring into the classroom with this, we would inundate our students with all of this information. Yeah. And we would ask them to read all of these chapters in these books that had like 1,500 pages.
Yeah.
Well, this is what would happen, right? Students would get their highlighters out.
Yeah.
And they would have like 2 or 3 different colors of highlighters. And then every sentence on the page is highlighted. Because everything is important to the student.
There's so much anxiety there, because there's no way to memorize all of that information, and but you put that expectation on yourself as a student I am just going to memorize all of this and hope that the question mirrors what I'm, looking at in the textbook.
Absolutely. And so for faculty, our role is, how do we pull the need to know from the nice to know? And so when you speak of the radical things that happen in our program, one of the things that was the most radical, and my faculty, they still look at me like, I cannot believe that we did this. I said, guys, how about we get rid of the textbooks?
Yeah.
They cost a lot of money.
Yeah.
Our students really, they can't afford them. And they cost a lot of money. Some of them are not even using the textbooks. The textbooks are coming back. They're going back to the bookstore, and they're still pristine and brand new. The other ones are using them too much because they don't know what it is they need to get from the textbooks. And we actually kind of tell them when we get to the classroom what we want them to know anyway.
Yeah.
How about we keep streamlining that process? And if we want to send them to resources, if we want to send them to the American Heart Association to find out some information, how about we just send them to their website? How about we send them to the places where they can get real, contemporary information and get rid of the textbooks? And we did that.
That's one of the most amazing parts of this story, I think, is because you really took a hard look at how people learn and what is kind of the conventional way of doing things, and is that really necessary? And I think that's, to me, that's like the most courageous part of this is like, challenging that paradigm, that mentality that like, do we really need textbooks? Because normal nursing programs that's all we know. We have these, massive books, and like, that's how so it's just amazing to me to just say, like, we're going to just not do that. And people learn from, going online, or, learn from their phones and stuff. It just implementing that new way of education. It seems so simple, right? It seems so, we should expect that of ourselves in modern day nursing, but I think it's hard for people to really break away from that thought.
Yes.
Yeah.
It is very difficult because one of the most frustrating phrases in the human language for me is, because we've always done it that way.
Yes.
When you ask someone, well, why are we doing this? Well, we've always done it that way. Mm-hmm. And I am an innovator. The way that I think I'm, well, that's not. How about we do it the best way instead of the way that we've always done it? And so the first thing when I became chair in 2017, I wanted to do a SWOT analysis. What are our strengths? What are our weaknesses? What are our opportunities? What are our threats? And when we looked at our students, in my mind, I was like, you know what? We are teaching the students that we wish we had instead of the students that we actually have.
Yeah.
So, so what are our students' strengths? And what do we see as their opportunity?
Yeah.
Our students were not very good standardized test takers. They just were not. And we were about to send them to take the standardized test of a lifetime with their licensure exam.
Yeah.
The National Council Licensure Examination, everyone knows it as the NCLEX. If you have any nursing students in your family, any nurses in your family, you have heard about the dreaded NCLEX.
Yes.
And so we were trying to prepare students to take a test that we were not truly preparing them to take. Because you need practice with things. We were like, they need practice with the actual test type.
Right.
Because students now, especially in our current climate, repetition is important. We learned even in the classroom, because we have computer labs, so all of our tests are computerized. We don't have paper and pencil tests because the licensure exam is not paper and pencil.
Yeah, that's smart.
If you ever put a student in front of a test and there is a question that they have not seen before, if there is a word in a question that they have not seen before, it's like, what? You didn't teach us this. We've never seen this before, but wait, well, hold the press. Hold on. You know the prefix. You know the suffix. Can you look at the word and deconstruct it and break it down? And can you figure out what it means? We have given you some tools to where you can think your way through this. And so our biggest challenge with our students was, we're going to have these test reviews. If a student made a certain grade on a test, it was mandated that you have to meet with your personal faculty mentor. Every student was assigned a faculty mentor that came into our program.
Yeah.
You are going to meet with your faculty mentor, and we're going to do a test review. Now, anyone who's gone through any nursing program knows that nursing tests are golden. They're top secret. You can't see the test anymore. Once you see it, you can't see. But you know what? Yes, you can see. We're going to bring those questions because I need to know how you're thinking.
Yeah.
I need to know how you're thinking as a student. I need to know, are you missing the question because you don't understand the content? Are you missing the question because you just didn't study the content? Are you missing the question because, you don't know your keys in the question? We need to figure out why it is that you are not able to answer. Is it a particular kind of question that you're missing? We have a lot of select all that applies, our favorite question type in nursing. And our students were really struggling with that question type. And in our program from 2018 until this very day, when they get to their last semester, up to half of their tests can be select all that applies.
Wow.
And it was intentional because we were hearing that, well, the NCLEX is all select all that applies. I only get all select all that applies. Well, you know what? Well, our test needs to mimic that. But you know what? we saw that every semester they got better and better with answering those questions because they had the practice.
Yeah.
They were seeing them and they were expecting. So it's amazing what you see when you actually put things into your curriculum. You build a curriculum that suits your students' needs. So I would just encourage any faculty, any leader of a nursing program, you need to make sure that you know your particular students.
Yes.
You need to work to what the opportunities are with your students and build your program not from a cookie cutter framework, but from something that's very specific to your program.
Yeah, absolutely. There was something that you had, the implementation of somebody to analyze the tests afterwards, this whole conversation is probably going to bring me right back to 10 years ago when I was in nursing school. Graduated. But like, I remember right after the test, you're right, you would never see those questions again. And you would immediately go to your other, classmates and be like, what did you put for this question? Like you're trying to remember exactly. And you're trying to analyze it in that same way and just think about it with other students. So the fact that you kind of took that and you made it a part of your curriculum, that's so smart. It's just another way that you saw what your students were doing and made it a routine practice to do.
Yes, and another layer to that was actually before that they ever get to their faculty mentor immediately after the test. And I'm telling you, my faculty, they're awesome. They're wonderful. We are 7 deep, we're 7 strong, and each one of them bring their own unique flavor to this program. Couldn't make it without either one of them. Yeah. I'm the face of the program, but they make me look really, really good. Another thing that we implemented is immediately after the test, the student can see the questions that they missed. They have to write, we give them a form, they have to write those questions down, and we give them the rationale at that moment. They have to write the rationale.
That's awesome.
Because you know what? We need you to know why you missed the question.
Yeah.
Because that's how learning takes place.
And I'm sure the students love that.
Actually, they don't.
Oh, really?
They don't because in the moment they're disappointed because they're trying to count how many X's I have, how many questions did I miss. But in the long term, but here's the beauty of that, and this is a true story. We actually started that because there was a student that we noticed, and we weren't doing this before, but there was a student that we noticed, and she would sit after her test, and she would just sit there and just read her rationales over and over, and she would just write down, and then they had to turn in their paper after, so we would take it up so they wouldn't keep it. But she would just do it over and over, and she became stronger and stronger throughout this program. Yeah. And we were like, you know what? We need to do that with all of our students.
Yeah.
So we took something that we had seen a student do who actually became stronger and stronger throughout the program. We were like, well, they're all going to do this. And we think that that's also just a piece of the puzzle. Yeah. Because repetition and seeing that and, knowing why you missed what you missed, rationales are important. Yeah. And when they go to see their faculty mentor or the retention specialist, one of the things that we ask them is when you're answering your questions, when you're taking care of a patient, because it also transfers to real life. Yeah. Whenever you are taking an action for a patient, you must have a reason for why you are taking that action. And if you have no reason, then it is the wrong action. And so we try to get them to think through things like that.
Do you think, because these strategies were implemented during COVID, right? Yes. I mean, this was and clinical wasn't something, or it was taken away from students.
Correct.
So I feel like, or how do you think that in my mind, I would feel like it only benefited the students to have this kind of like scenario play out of circumstances so much more instead of just like textbook and then no clinical. I feel like that probably really helped during that time.
Absolutely. What also helped, again, just to add to that, simulation, just to go back to 2020 for just a minute. And, because it was our spring break when COVID kind of was happening
Oh,
here.
yeah.
And we were told, well, don't come back after spring break.
Right. That's right.
That's a nightmare for nursing. Don't come
Yeah.
back. Well, wait a minute. What do you mean?
Yeah.
And so we're talking about the way that we test, because this is something else that was radical. The things that we did here, and that I still have a faculty, is amazing, that they didn't just pick up and walk out on me and say, you must be out of your ever-loving mind. Because our students, they couldn't come back on campus. We had to allow them to take their test. And I was like, well, you know what we're going to do? And they were at home taking tests. They can take open book tests. What? We're not going to use respondents? We're not going to use respondents. They're going to take open book tests. If we are writing the questions to a high enough level to where they really have to think their way through, then just having the facts are not going to help them. We're going to have to make sure that we're writing questions that are at a critical thinking, clinical judgment level. Right. They're going to need to know more than just what a normal hemoglobin and hematocrit level is. They're going to need to know what to do with it according to a specific patient. And so, again, the faculty was like, but all of our questions, they're going to be out there. And the students did. They took screenshots of the questions they did. And it was like, well, we're never going to be able to use the questions again, guys. I'm sorry. We're going to have to shred them. We're going to have to throw them away. Yeah. And we're going to have to make some new questions because we write all of our questions. We do not use test banks. We know that test banks have been compromised, so we don't use those. We create our own questions here in our program. And but the simulation, because we couldn't go into the hospitals, and they were like, you can't come, but we have to have, what are we going to do? We have to do something. And so the virtual simulation and creating scenarios where the faculty would get onto these virtual calls with these students, because we had a learning management system that would allow us to do that. And they would go in and they would have these, again, case studies, these scenarios, and we'll walk through, well, if this, then what? Yeah. And, just go around in a round table type thing, talking to the students. Okay, it's your turn. Okay, we've done this with the patient. What do you expect to see if? And I think that's the part too that we miss sometimes, even when we're in the clinical setting, because sometimes in the clinical setting we're so involved with the doing
tasks,
the task, that we don't think about the cognitive and connecting the dots. Okay, well, you've given the medicine. What do you expect to see in the patient now that you've given it? What are the expectations? What are the adverse? What would you see if the patient takes the medicine and something goes wrong? Yeah. And so always thinking that piece through, just the what ifs. If this, then what? Always learn to ask that question of your students. If this, then what? And that should become the students. Okay, if this, then what? Yeah. Just a part of their thought process.
I feel like we have to talk about your faculty, because it seems like there's so much, they have to be superheroes, because they have to know, you take away books. So they have to, know that content like the back of their hand. There's no PowerPoints there that they can, go off of. And then they know their students really well. I mean, I think that's got to be a huge piece of, implementing, a progressive system, is just having amazing faculty.
Yes. I could talk about my faculty all day. Like I said, each one of them brings unique qualities to the table, if you will. I will start with, let me just start with Mrs. McClure, because she wrote a grant for us back in 2020 during this whole COVID nonsense. She actually wrote the grant in December of 2019, pre-COVID. And it was for students from disadvantaged backgrounds, because, we have plenty of those throughout our entire program. We're in rural Alabama. We're here in Sumter County, one of the poorest counties, not just in Alabama, but actually in the nation. Yeah. And we were needing financial resources for our students. Our students are having to work. They're having to take care of their children. They're having to take care of maybe parents who have ailments or grandparents. Yeah. We just have a lot of things going on with our students here. So they're having to work. And if you're having to work and take care of a family, then steady time, you just get it in when you get it in.
Yeah.
And so I do think that was affecting their ability to be successful.
Mm-hmm.
So she took on writing this grant over her Christmas break. And lo and behold, we were in the middle of COVID, and there wasn't very many people here in this building, and we were screaming our heads off because we found out that we were awarded a $2.4 million grant.
Oh, my God.
Yes. And we were so excited because the grant is purely to give scholarships to our nursing students.
Oh,
And it's over a 5-year period. So I start there with talking about her and that grant because it was a great opportunity for our students. And then I have my simulation faculty. They don't just do simulation, but that's where they kind of live. Dr. Rhonda Gonzalez and Dr. Jennifer Harwell.
Mm-hmm.
They work with our students starting in the second semester, and they take them through the human patient simulator, and every semester they level up on what it is that they are supposed to be able to do when they go in there. Now, we learned early on that you cannot let the patient die. You cannot let the simulator die because students will have an emotional response, just as though it was a real patient. So we learn a lot of things in their debriefing and what they do to help the student. You know what these are the things you did well, and here are some opportunities that we have coming from simulation. Dara Murray, she is my Dr. Dara Murray. She is my technology guru, all things tech, and she's also our maternal child person. I don't know anything about birthing babies, but we do have a maternal child simulator, and that's where she lives. And then we have our fundamentals faculty. We can't do anything without them. Dr. Shanita Hill, Dr. Katie Smith, and Dr. Marsha Cannon, who teaches pharmacology. And Dr. Marsha Cannon, she is our senior faculty. She's been here for 20 plus years. So I have rock stars here on faculty. They all have their doctorates with an emphasis in education, with the exception of Mrs. McClure, but she's in her doctoral program now. So yeah, they're pretty amazing women.
Yeah. That's what I was, when you were saying all their names, I was like, doctorate. But yeah, I'm sure that speaks volumes for, what they can do for their, how they say BSNs, there are like correlations of like patient outcomes. I'm sure that there's correlations with doctorate and, the way that your students can succeed.
Absolutely. You know what? Each one of these women, they are experts in curriculum development. They are experts in instructional design.
Yeah.
Their degrees make them experts, and we were determined that if we're going to get these degrees, we're going to put into practice these things that we are learning. And I think that it is evident in our program and how the results that we are having. Look, we believe in best practice. Here's the thing. We're going to take the pieces of best practice that actually fit with our students, and we're going to use them. What works, we're going to keep, and what doesn't work, we're going to throw it out the window because it just doesn't work for us. And we have built something that, hey, we found something that works, but the key is we have to keep our fingers on the pulse. Of what's going on around us, and we can't get complacent. Look, I'm a graduate of the University of Alabama, so Coach Nicholas Saban, I am. He doesn't know it, but I'm one of his disciples. We cannot be complacent. We have to keep moving.
Yeah, I mean that's we teach that in nursing school and with evidence-based practice, like you said. One of the worst phrases in nursing mankind is, we're doing things just because we've always done it.
That's right.
That's where practice goes to, So I'm sure like surrounding yourself with people that have built their education on evidence-based practice and trying new things that only helped, I'm sure that there probably wasn't at the time. When did these practices start? 2011, you said? When did you start like revamping?
We started these in 2018.
2018.
Yes. In 2018, our score dropped to 78%, I want to say.
Okay.
Because I took over in 2017.
Okay.
And then in 2018, we dropped. And to know my personality, I always tell people that I am not an overachiever, but I am a high achiever. And so we needed to do some things in a hurry to get things turned around. And it was just great having a team who was
Valued
willing.
That. Yeah.
Yes.
Right.
Yes.
I think that's the point I was trying to get at, was there was probably no opposition in saying this is how we always done things, because you surrounded yourself with people that were, literate in the ability to, propose like progression and change and not afraid of it.
Yes. They are wonderful. And also in that change, because we also decided in that time in 2018 that we wanted to have a BSN program, because this program has been in existence since 1974.
Wow.
And we decided we wanted a BSN program. And we pursued one. And now we have our online RN-to-BSN program to complement our ASN program.
That's
so
amazing.
They've been busy, the faculty.
Yes. Surround yourself with faculty that will propel your program.
That's exactly right.
One of the biggest measures. Yeah.
Yes.
So I want to, kind of line up just for organizational purposes. We talked about the importance of faculty development. We talked about assessing your student population to meet their needs, like creating a curriculum to fit the students. We talked about the faculty student mentoring and how, important that is for the outcomes. I want to talk about UWorld because it's something that I hadn't heard about before reading the article that I found of you with Minority Nurse. So what does that look like? What is that, and how did you implement it in with your program?
So UWorld is a question bank. It's technology. It's so odd that we talk about technology and how can it be used in nursing education. When we were struggling in 2018 and we were at our wits' end, like, well, how are we going to get these students prepared to go and take this licensure exam? What can we do? And we had been using a product, and I won't say what the product was, but we were using a product to help our students take practice questions and take practice tests, and it just was not a great predictor for us, and it wasn't prepping our students. I don't know what the disconnect was, but it wasn't working. And we had a student in 2015, who had used the UWorld product before, and I remembered it. And I was like, let me reach out and just get the name of this product. And I said, we're going to try this with our students. I had no idea if it was going to work, but let's just see. But I had read an article that said that students need to take at least 6,000 questions or so before they go to take their NCLEX exam.
Wow.
They needed that kind of practice. Okay. Well, UWorld holds, the UWorld question bank holds 2,000 unique questions.
Okay.
I said, okay. So we're going to make the students, before they graduate, they have to take every question. That's all we knew. We didn't have any policy. We just take the questions. So they did that. And our score went up to, I think, 84% the following year.
The NCLEX pass rates?
The NCLEX pass rate went up from 78 to 84%.
Wow.
We was like, okay, with our student population, we have something going here. We have, but now we need to formalize this. We need a policy. We need to, because, students, if you do not attach some type of incentive, and we always try to, we don't want to be punitive with our students when we're doing things. We want to make sure that there's a purpose to it. So we were like, but if we tell them there are points attached to it, then maybe they'll do it. Maybe they'll be more incentivized to get this done. And so we tried to come up with a policy. So the next year, the score actually dipped a little bit. It was like 82 point something, 82.4 maybe was the score. And we were like, well, maybe we need a more robust policy. And then here comes COVID. I was like, oh no, our scores are going to be the students are not on campus. We have no control of what they're doing. We don't know if they're going to do this right. And we only assign UWorld in the last semester. And what we ask the students to do with the policy finally looks like this. There are 2,000 questions. You have to complete the 2,000 questions, but kicker, you have to make at least 65% on these questions because it scores you. And we were finding that students were having to take the questions multiple times to get to the 65%. So some students were taking 2,500 questions. Some students were taking 5,000 questions because they were having to repeat. But you know what? If you're repeating it, then hopefully, eventually, you're going to learn whatever it was that you were missing.
Right.
And, that's the year that we had we got to our 100% pass rate because now they're getting their points and they're needing their points. And we have found something that works for us because we have a true policy that's attached to this. And we found I really believe that UWorld, I called it a game changer for us and for our students because, again, when we started our conversation, I said that my students are not good standardized test takers.
Right.
And this was something that helped them to get to where, I can't say that anymore. You know what? They're pretty decent standardized test takers by the time they leave our program.
Yeah.
Because we have built in some things to help them to get to that. And we want to make sure, if we bring you into the nursing program, if you progress through the nursing program, you graduate from the nursing program, then you know what? You deserve to be a nurse. Because we know we've given you the skill to practice at the bedside. Yeah. One exam should not prevent you from following your dream and getting to completion.
Yeah. Because I can't imagine, we were saying before, I can't imagine having that plaque on your wall and then not being able to practice.
Absolutely. Yes. And I tell them, I was like, the last thing you want to do is go through a program and say, I graduated because it's interesting. It's always an interesting thing to me because our students go and get these big block letters that say RN and they take their pictures on when they're getting ready for graduation. I'm like, gosh, you're not an RN yet. You have to take the licensure exam. You're not an RN yet.
Yeah.
I'm like, and it would be so sad to have taken all these pictures, to have had this ceremony, to go through this pinning ceremony, to do all of that, and then not pass your licensure exam. Right. And we don't want to have those stories. Not here. So we're excited that we've been doing really well here in the last 2 years. We're excited.
Now, when you have students that you identify that aren't doing well or that are, that have these like extra factors, external factors that are preventing them from doing, what does retention look like? What were some of the strategies that you, how personal are those, or individualized, I guess?
Right. That's a great question. So what happens is when students are admitted in their very first nursing course, they are assigned randomly to their faculty mentor. And we don't know them well enough to know who's going to blossom and who's going to need a little extra push. Yeah. If they are part of the Project Earn scholarship, the scholarship from HRSA that we received, they are automatically assigned to a retention specialist. Now, in full disclosure, I am one of the retention specialists that they have to come see. I think they try a little bit harder just because they don't want to come see me.
They're like, oh, please, no.
I know, I'm going to the principal's office. But what it looks like is there are certain flags that are in place. So our passing standard here, you have to have an 80 in order for it to be considered passing. If you fall below 80, then you have to go see a retention specialist. If you stay above 80, but you're between 80 and 84, you have to go and meet with your faculty mentor. And that's with every test that they take. Because, again, we're trying to catch you before we get into trouble. We don't want to see you after you're in trouble. We want to see you before you get into trouble. And so what that looks like is we're asking very pointed questions. Are you coming to class? When you're in class, are you taking notes? Do you know how to take notes? We may ask them to bring their notes with them to their session so we can see the notes that they're taking. We're asking them, so do you have test anxiety? Because maybe they don't know that there's an ADA office here on campus, and maybe they don't know that they have access to certain accommodations that they could have if they need them. So we're just trying to make sure that they know everything that they need to know in order to be successful. Test taking strategies. We we walk them through certain things, and they also have a product where they can go on and they can look at any time they want to see certain questions. There are certain things that they can do. Are you finding your keywords again in your question? Do you know what that looks like? Priority questions. Do you know what a priority question is? Do you know how that's first versus most important? So, just trying to help them to identify some of those keys that nursing may be the first time that they've actually seen those things. Yeah, we want to make sure that they understand what it is that looks like. And as far as the studying piece goes, to back up a little bit, we want to know, are you studying alone or are you studying in group? Right. If you're studying in group, are you studying with your best friends? If not, that may not be the group you need to be in. Because are you studying or are you talking about shopping and what you're going to eat and the movie you're going to go see? So we need to be intentional about the groups that we're in. Sometimes we need to help them to find a group. Yeah. So we're just very intentional about what we're trying to do to help them be successful.
Have you, in all of these different strategies that you've implemented, have you been able to kind of like circle back and get like closed loop feedback from some of your students as far as like what things they think has helped the most?
We do a survey at the end of the program.
Okay.
Where we list them all out and we ask them, and you know what, it's so crazy because students are all over the place.
Yeah.
Depending on the students, they love their mentors. They absolutely love having a person that they can go to, because sometimes the students, they don't seek out their mentor. They can make an A on the test and they still want to go and see their mentor. Yeah. I missed 2 questions, but can I see the 2 that I missed? And sometimes we don't know if our students have a support system at home.
Yeah. And
sometimes they need someone just to celebrate with. And maybe we are that piece for them to celebrate with. So sometimes it's not just about, college is a complete experience. Yeah. Coming to college was always supposed to be a complete experience. And especially in nursing, a field that is, for me, all about compassion and caring. Yeah. Just because we became educators, we didn't lose that as nurses. Right. And so for our students, when they need us sometimes just to listen because they had a bad weekend, something bad happened, and they have things on their mind and they just want to come and they just want to talk. Yeah. Well, you know what? They're mentors for that too. Yeah. They're mentors because they don't have anyone else to go to. And sometimes as mentors, we need to send them over to get counseling that we're not certified to do. So that faculty mentor role can look different for different students.
Sure.
But it was intended to help them with their learning outcomes. Yeah. But sometimes it turns into other things.
Yeah. Well, I'm sure it comes full circle, because if you have a student that isn't doing well because of, things that are going on in their life, just the fact they probably feel seen by their professors, that their professors acknowledge what's going on and they have an understanding. I feel like just that alone probably helps people, keep going, instead of just being like, they don't know what's going on and I don't know how to get out of this, so I'm just gonna, quit the program.
Yes, and that is one of the advantages of being on a small campus. Yeah. and having small class sizes. Is that we know our students really well. Yeah. We know them by name, and they know we have open door policy, that they can come in and they can just plop down and start talking.
Yeah.
Sometimes we know more than we want to know.
Right. Like, I got compassion and empathy, but I'm still your professor, you know.
Yeah.
Oh. So tell me, you know, just to bring it home, what were the results of the program changes? Kind of what did you see when you took a step back and looked at everything?
Of course, the NCLEX pass rates, those were the obvious changes. But I think that we also saw, for me, I think that for the faculty, I think it invigorated us because just seeing those changes and just knowing the power that we hold to change things. Because we have a very supportive administration, and so just knowing the power that we have to create opportunity, and that we can create equitable situations here for our students, that's pretty powerful. That we're giving opportunity to students who may not have those opportunities in other places. That is pretty.
It's remarkable.
It is. I'm trying to find the word because I've never been asked to describe it before, and it's just something that we do every day. But when I sit back and I think about it, you know, it is a blessing. That's the best word that I can use to describe it, because it just makes you feel good inside. That you have the opportunity to help people to achieve their dream. To become because all they want to do is just help people. They want to go out and they want to be nurses, and then they can actually come here and they can do it because they're like, you know, we ask them for their ACT score as an admission requirement. And the phone calls that I'll get, like, well, what do I have to make on the ACT score? We don't ask you for a certain ACT score. We just want to know what is the ACT score, because we just need a baseline. We just want to know,
okay,
can you take a standardized test? And if not, then just where are you on the continuum? And like, what are we working with? And so for them to be like, it doesn't have to be a 20. It doesn't have to be a 20. No. We just want to know where are you? So it's great to know. It is great to be here on this campus and do the work that we do. And those are the gains that don't necessarily show up in data. But to me, it's the most important gains.
To be honest, when you were talking, I got a little teary-eyed because
oh my goodness,
it is. Just your ability to be a catalyst for change. I think for some reason, I think it just makes me emotional because I think it's so hard. Sometimes a hospital just feels like a slow-moving ship, you know, and a lot of nursing programs, it's hard to be the change. It's hard to make change.
Sure.
And the fact that you were able to, you know, empower your students and your faculty to make really, you know, significant change, I think is just incredible. And I'm so happy that we were able to have you on today to hopefully, you know, other nursing professors or department heads can just listen to this and maybe just, you know, get inspiration to you know, introspectively look at their programs and the climate and improve the big problems that we have. So
well, thank you. Thank you for that, and thank you for having me.
Well, I think that we're going to end it here. I think that was a great way to end it. So, Dr. Hanks, thank you so much for coming on today. I will talk to you soon.
Thank you so much, Maggie. I appreciate it.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.